Knock, knock. Hi, I'm Liz. I'm going to do a quick assessment on you. I'm going to shut this door and use some hand sanitizer to clean my hands. Can you verify your name and date of birth for me?
Reed Dawkins, 10/1995.
Awesome. So I'm going to first start out by inspecting your arms. I see that they are appropriate skin color for the ethnicity with some freckles, and it is warm to the touch. I'll go ahead and palpate your radial arteries and then brachial. Great. They are bilaterally symmetrical at a +2. I will then check your capillary refill. I'll do this by pressing your finger and waiting for it to fill up. 1, 2, 1, 2. Great. It filled up appropriately. I will then do a touch test. Do you mind closing your eyes for me? Okay. And when you feel it, please let me know.
Feel, 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 feel.
And in a normal assessment, I'd have the patient remove his clothing on his upper arms, therefore I could assess it better, but his sleeves do not roll up that high. I will now have you hold your arms up to the side. You don't have to stay there, and then down, and then above your shoulders, praying hands, and then back behind your back. Perfect. Now, will you flex and let go, and then I will have you hold your palms up, supination and pronation. I will then have you turn your wrists in and out, and then I will have you make a fist and open. Now touch each finger to your thumb. Great. Any history of arm injuries, broken arms or anything?
No.
Okay, and I'll have you sit back down. I'll now go on to the legs. I will bend down and then pull up his pants as high as they will go. I see that hair is evenly distributed, no signs of any edema. They are symmetrical, no lesions with some freckles as well. That is appropriate for his ethnicity, which is the super Caucasian man. I will then feel his dorsalis pedis up here on his, right between his second, don't have to flex this, but between his second and big toe. Great, I feel them bilaterally +2. I would normally take his socks off, but I don't really want to smell his feet right now. Then I'm going to take my fingers and go behind and feel his tibial, posterior tibial pulses. Great. They are bilateral +2. So I'll have you put your feet down again. I'll have you lay down. Any history of numbness, tingling, or anything in your legs?
No.
Okay. I'll test range of motion for his hips. So I'll start by making the knee straight, lifting up to the side, abduction and adduction, and then bending the knee and pulling up as well. Same with the other leg. I'll keep it straight, pulling up, adduction and abduction, bending the knee, and he has full range of motion in his legs. While I have him laying down and have easy access, I will do the touch test as well. I would normally have the patient's legs exposed, but for the purpose of this video, I'm having him keep his pants on. So close your eyes for me and tell me when you feel a touch.
Touch, 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 touch.
Okay.
Touch, touch,
The sharp end.
touch, touch, touch,
And
touch, 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 touch.
Okay, I'll have you sit back down with your feet dangling. Great, so I will have you toes to nose and press the gas pedal. Great, and now you will rotate your ankles in, and your ankles, just your ankles, not your knees. In and out. Like, you know, like that. Perfect. And then your toes. Move your toes up and down. Perfect. Now we're going to assess your neuromuscular. So, any history of head traumas?
No.
Any history of concussions?
No.
Okay. I will have you. I really hope it's still going. Yes, it is. It just says low battery. Okay. Good call. I'll have you stand up for me. His posture's upright, no slouching or anything. I'll have him step to me, normal walk, and then I'll have you turn around and walk heel to toe. Okay, looking with your eyes closed, I'll have you stand for 15 seconds. Okay, patient is not swinging, which means it's a negative Romberg test. With your eyes still closed, I'll have you take your fingers out and touch your nose. Nose, nose, nose. One more time, and nose. Great. I will now have you do something called rapid alternating movement. So if you'll just follow my lead by, perfect, like playing patty cake. Then I will have you turn around and I'll inspect his spine. It looks like he has a little bit of lordosis here. I'll have you touch your toes, please. Slowly, while I feel his back. And no signs of lordosis, kyphosis, or scoliosis. I will now have you twist and move from one side to the other. Great. Thank you